welcome Dr. Heba Abdelmowla, coordinator of the conference. And now we'll start with the first topic about neurological associations of COVID-19. Welcome Dr. Heba. تفضلي.
بسم الله الرحمن الرحيم. شكرا لسعادتكم على الدعوة. Neurological Association of COVID-19. What is a neurological nurse should know about COVID-19?
This is SARS-CoV-2. It belongs to the family of coronaviruses named for the crown-like spikes on their surfaces. SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily your throat and lungs. What actually happens in your body when you contract the coronavirus? What exactly causes your body to develop pneumonia? And how would a vaccine work? The coronavirus must infect living cells in order to reproduce. Let's have a closer look. Inside the virus, genetic material contains the information to make more copies of itself. A protein shell provides a hard protective enclosure for the genetic material as the virus travels between the people it infects. An outer envelope allows the virus to infect cells by merging with the cell's outer membrane. Projecting from the envelope are spikes of protein molecules. Both a typical influenza virus and the new coronavirus use their spikes like a key to get inside a cell in your body, where it takes over the cell's internal machinery, repurposing it to build the components of new viruses. When an infected person talks, coughs, or sneezes, droplets carrying the virus may land in your mouth or nose and then move into your lungs. Once inside your body, the virus comes in contact with cells in your throat, nose, or lungs. One spike on the virus inserts into a receptor molecule on your healthy cell membrane like a key in a lock. This action allows the virus to get inside your cell. A typical flu virus would travel inside a sac made from your cell membrane to your cell's nucleus that houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access parts of the host cell called ribosomes. Ribosomes use genetic information from the virus to make viral proteins, such as the spikes on the virus's surface. A packaging structure in your cell then carries the spikes in vesicles which merge with your cell's outer layer, the cell membrane. All the parts needed to create a new virus gather just beneath your cell's membrane. Then, a new virus begins to bud off from the cell's membrane. Now, with the virus spreading in your body, how can you develop pneumonia symptoms? For this, we'll have to look into your lungs. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon. And when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries, and then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. In a healthy body, hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you might expel them by coughing. Normally, cells of your immune system attack viruses and germs that make it past your mucus and cilia and enter your alveoli. However, if your immune system is weakened, like in the case of a coronavirus infection, the virus can overwhelm your immune cells, and your bronchioles and alveoli become inflamed as your immune system attacks the multiplying viruses. The inflammation can cause your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. You could develop lobar pneumonia, where one lobe of your lungs is affected, or you could have bronchopneumonia that affects.
The COVID-19 pandemic caused by severe acute respiratory syndrome. Coronavirus is not seen since 1918 influenza pandemic. Coronavirus neuropathogenesis of COVID-19. Neuromechanism is there is a neuroinvasion by 4 routes. The first one is transcribial route, as innate olfactory epithelium, the virus attacking olfactory epithelium, then transfer to the olfactory bulb to enter into the central nervous system. The second route, transsynaptic transfer, in which the infection can pass through blood-brain barrier. We have also 2 different sites, leukocyte infection. Infected leukocyte can transfer through blood-brain barrier, and infected vascular endothelium cell has been spread to the central nervous system. Severe acute respiratory syndrome, first represented in December 2019, with case unexplained treatment of resistant pneumonia. Around 350,000 confirmed cases by March 2020, and 0.25 to 3% of global mortality rate. COVID-19 not previously be encountered by human, and no humoral immunity until now. COVID-19 present by severe acute respiratory distress syndrome, but also can include neurological complications. Neurological manifestation, the magnitude of COVID-19 pandemic will result in sequential neurological disease, whereas direct infection which rare, para-infection less rare, and critical illness is a common. We have 2 main complications of neurological caused by COVID-19, acute ischemic stroke and intracerebral hemorrhage. The pathophysiology is this complication resulting from damage to the receptors, cytokine-related injury, secondary to hypoxia, and retrograde travel along the nerve fiber, which will reproduce acute cerebrovascular disease, encephalitis, encephalopathy, Guillain-Barré syndrome, and lymphadocytosis. The neurological manifestation of hospitalized patient with COVID-19 in Wuhan, China, by early 2020, there was a cohort study done in 214 patients with confirmed COVID-19 were reviewed. The main result, the main complication, acute cerebrovascular disease, 88%, followed by encephalopathy, 76.5%, ischemic stroke, 44%, and Guillain-Barré syndrome, 90%. Cerebrovascular complication common with elder people with severe COVID-19, higher prevalence morbid conditions such as hypertension and diabetes mellitus. Neurological symptoms reported in 1/3 of the patient having COVID-19, 15% having reduced alertness, 20% having neuromuscular symptoms. Neurological symptoms happened without any typical presentation, such as fever, cough, and throat pain, but common with non-specific manifestation. COVID-19 ran into 2 phases. The phase 1 is the initial phase. It started from 3 to 5 days with non-specific neurological symptoms, followed by the second phase. Coughing, fever, shortness of breathing are common. Elevated D-dimer were observed with patients with COVID-19. It may be included or indicated as multi-organ microangiopathy, pulmonary embolism, myocardial infarction, and stroke. But take care, D-dimer is an investigation indicated there is a blood clot somewhere in the body. But considering it may increase normally with age over 60 years old, recent surgery, patient having severe liver disease, sickle cell disease, and with smokers. According to the representation of symptoms, there is some symptoms appear in patients with COVID-19, such as smell disorder, taste disorder, myalgia, and headache. Headache is a common initial complaint associated with dizziness, impairment in the thinking, and problem in the eye such as itching, excessive tearing, and redness. Impaired consciousness, several vascular mechanisms may lead to impaired consciousness such as direct infection and the damage to the brain parenchyma, toxic metabolic encephalopathy, seizure, and demyelinating disease. Toxic metabolic encephalopathy is a condition that the function of the brain is damaged temporarily or permanent. Severe inflammation, sepsis, renal dysfunction, and electrolyte abnormalities. Encephalitis is the inflammation of the brain parenchyma usually caused by COVID infection. Seizure may be a result of unconsciousness or change in consciousness due to hypoxia, organ failure, and metabolic derangement. Also, stroke vascular event leading to ischemic stroke and intracerebral hemorrhage. The nurse easily can detect a stroke within few minutes or hours. This by mnemonics called B fast, as B represents the balance, E I, the face represented by letter F, the arm and speech and time as early as you can. You should report this case. Finally, the complication may affect the peripheral nervous system through anosmia and ageusia. Anosmia means represented in 5 to 88% of patients that mean losing of smell, and ageusia means losing of taste, which is common represented with patients with COVID-19. And we can detect or diagnose COVID-19 even if we lost smell or taste. Also for peripheral nervous system complications, Guillain-Barré, which is, as you know, peripheral nervous system is a network covering or arranged the spinal cord with the brain and affecting limbs. Take a home message, stay safe.
In by other people. That's the most common way the virus can spread. Another way it can spread is when those infected droplets land on surfaces like door handles and elevator buttons. If a healthy person touches the surface that has droplets on it and then touches their eyes, nose, or mouth, it's possible for them to get sick. These are gateways for the virus, so the less you touch them, the less chance there is for the virus to enter your body. That's why everyone keeps saying, don't touch your face. If the virus gets on your skin, like on your hand, you want to wash it off by using soap and water or hand sanitizer before it reaches your eyes, nose, or mouth. It may be possible for a person with COVID-19 to pass the virus to others when they aren't showing signs of being sick. This is called asymptomatic transmission. It often takes 2 to 14 days before people start to feel sick after being exposed to the virus. So you could be getting other people sick without knowing it. That's why when there are a lot of cases of COVID-19 in an area, leaders recommend staying home unless you really need to do something, like get groceries. And if you are feeling sick, stay home and call your doctor. What are COVID-19 symptoms? Some signs of being sick with COVID-19 are a fever, cough, body aches, and trouble breathing. Some less common symptoms of the virus include headache, sore throat, runny nose, problems with sense of smell or taste, nausea, and diarrhea. I know it can seem like anything can be a symptom of the virus, so if you aren't feeling well, stay home and call your doctor. Most people who get the virus will experience mild symptoms. Some people won't experience any symptoms at all. Most people, including children, who get sick with COVID-19 can recover at home. But for some people, especially people who are 65 and above, people who have other health problems like lung conditions, diabetes, and heart disease, and for people whose immune system or infection-fighting system doesn't work so well, COVID-19 may lead to more serious problems that require hospitalization. What should I do if I'm feeling sick? If you are feeling sick, have a fever, cough, or are having trouble breathing, call your doctor or local urgent care facility. This is important. Call first. And if you are sick, cover your nose and mouth with a cloth mask, scarf, or handkerchief. It will help protect the people around you. If you live outside the United States, check with your national health agency on mask recommendations. When you call, your doctor can tell you what to do next. Some people may need to come in and be seen by a doctor, and some people may need to stay at home and limit their contact with other people. Your doctor can tell you what you should do. What should I do if I'm worried I've been exposed? Your chances of exposure to the virus that causes COVID-19 increase if you are within 6 feet of someone who is infected, about the length of a bed away from them. You live in or have traveled to a location that has a lot of cases, or you were at a crowded event with someone who is infected, like a party. If you think you've been exposed to someone who has COVID-19 but aren't having any symptoms, call your doctor, hospital, local urgent care facility, or public health office. They can tell you what to do next. If you think you might have been exposed and you have symptoms like fever or cough, you should call before going to your doctor's office or to a hospital. Your doctor can tell you what to do and if you need to be seen in person. If you are asked to come to the hospital, you may be asked to follow special procedures, like using a special entrance away from other people and covering your nose and mouth. It's important to know that currently there is no proven treatment for COVID-19, but doctors can help support your breathing and make you as comfortable as possible. Most people will not need to stay in the hospital and will be able to make a complete recovery at home. What can I do to stay healthy? Wash your hands with soap and water. Really, I know it sounds simple, but it has a big impact. Basically, it's because soap breaks apart the container that holds the virus. Once the container is open, the virus just washes away with the water. For this to happen, you gotta spend some time washing your hands, and you need to scrub. You want to wash your hands for 20 seconds. That's the happy birthday song 2 times. You'll want to rub your hands together, clean your wrists, fingernails, in between your fingers, and dry your hands with a paper towel you can throw away. Lastly, turn the water off using the paper towel instead of your hand.
Thank you, Dr. Heba. Any question? Last session. Close. طيب اوكي اتفضل.
ثانكس دكتورة هبة، برزنتيشن جميلة ومرعبة في نفس الوقت. طبعا انا اتخضيت من الاستاتستيك اللي حضرتك عرضتيها، بس كان ليا سؤال، هل الاستاتستيك دي وورلد وايد ولا
انا كتبت انها early by 2020 في تشاينا.
في تشاينا، لكن مش ولا وورلد وايد ولا في ايجيبت.
مكتوب عليه الداتا هي منين وحصلت ازاي.
نفسنا طبعا ان احنا يطلع لنا استاتستيك كده في بلدنا نعرفوا الوفيات الكتيره دي كان ايه سببها او هو اثر على ايه. شكرا دكتوره هبه، وربنا يرفعه عننا يا رب جميعا.